into the room.
Hello,
Hello.
I'm Dr. Firoz. I'm one of the doctor in this emergency department. So, can you confirm your name, please?
I'm Pamela, doctor.
Mm-hmm. I understand that you are related to Mr. Jim Halbert. So, can you please confirm your relationship to Mr.
I'm his
Jim Halbert?
wife. I'm his wife.
Okay, so Pamela, um, I have been asked to talk to you about your husband's condition.
Yes.
Okay,
How
so
is he, doctor? How is he doing?
yes, we'll talk about it. So before we start further, can you please confirm his date of birth for me?
He's around 82 years of age.
Mhm. Okay. Okay, so Pamela, yeah, I understand that Mr. Jim Halbert is with us. He is admitted here. Okay, so I have been asked to talk to you about it. Before we discuss further, can I ask few details to understand what's happening with him lately?
Well, we were both watching TV when he suddenly
Mm-hmm.
collapsed, and then I called the
Okay.
ambulance immediately after that, and they brought him to the hospital. I mean, I
Ah,
don't know what
okay.
happened, doctor. How is he?
At this moment, he is not doing well. Okay, so we'll talk about it, about his
What do
condition.
you mean
So,
he's not doing well? What does that mean?
yeah, yeah. So, as we understand that he was brought by hospital, so we also did many blood tests. Okay, so yeah,
Okay.
so we'll talk about it. Just before, I just wanted to know, was he okay before these incidents?
Well,
Um,
he was complaining of a headache that he was having,
mhm.
but I didn't think
Okay,
much of
and
it.
okay, and what happened after that this collapse? Did he regain his consciousness at all?
No, not at all. In fact, I
Mhm.
called the ambulance immediately and I didn't even get to talk to him after that. You think I can
Okay,
talk to
and
him?
yeah, we'll talk about it. So, okay, and does he have any medical condition?
Yes, he does. He has high BP, and he's had
Mm-hmm.
a heart condition. It was something called angina,
Okay,
and he also
okay.
has diabetes.
Mm-hmm. Okay, so does he take the medication regularly?
Well, for the hypertension, he's taking some medication, and then since he had that heart condition, they gave him some regular medicine called aspirin and
Mm-hmm.
some simvastatin. But for the diabetes,
Okay.
he's on diet control. That's all, and he very religiously takes all these medicines. I mean, this shouldn't have happened. I mean, are you saying it's because of these problems that he has from before?
Yeah, and yeah, so actually he has this high blood pressure, okay, and
Mm-hmm.
he has this he has this also diabetes mellitus, okay, and so I've been asked to talk to you about your current condition, okay. So before we discuss further, so are you on your own?
What do you mean on my own? I'm with him.
Yeah, like do you think you need someone with you?
Um, I'm not sure. I have two
Mm-hmm.
daughters. They are currently in Australia at the moment.
Okay, because about me, Mr. Jim Halbert, we
Mm-hmm.
do not have a very good news today. That's why we thought that if you need any support before I give the news to you.
What do you mean you don't have any good news? What are you trying to say, doctor?
Yeah.
What is it? Just tell me, what is it?
Yes, unfortunately, as we understand that Mr. Jim Halbert was brought to the hospital by an ambulance. We also checked him. We did the CT scan and we also did other blood tests. And that CT scan result is not good actually. And the CT scan is showing that there is a bleeding in his brain.
What? I don't understand. And what does that mean, doctor?
Yeah, unfortunately, I'm really sorry to tell you that he has bleeding in his brain and his condition is terminal.
What do you mean by terminal? You think he's not going to
Yeah,
survive this?
unfortunately, he is not going to make it.
Are you giving up
And
on my
I'm
husband, doctor? How can you say this to
no,
me?
yeah,
What do you mean?
uh,
Isn't there anything you can do? You have so much of resources. You can do something for him.
yeah. I'm so sorry that if we are giving you this impression. As a doctor, we always try our best to help our patient, and we are not giving on him. Okay,
You have
so.
specialists in this big hospital. Can't you take their opinion? I mean, somebody could say something. They can operate
2 minutes
him.
remaining.
Yeah, so after we did the CT scan, that neurosurgeon also assessed him, and they decided that we'll give him this palliative care. Do you understand about it?
No, I don't know what is this. What is this palliative care?
Okay, let me explain to you. This is one form of supportive care, which we usually giving in patients to support them, like to improve their quality, to reduce their sufferings, and we want to make sure
What do
that
you mean
as
suffering,
long
doctor? I'm not understanding. Why is this happening to him?
Yeah, so as Mr. Jim Halbert having this high blood pressure, and sometimes because of this high blood pressure, it can increases the blood pressure inside the brain, and unfortunately, it causes this bleeding inside the brain.
I mean, and you're saying you can't do anything? Can I even talk to him? How
No,
much time does he have?
at this moment, we can't say how much time he has, but unfortunately, he's not going to make it. It maybe take some days, some months, but until he's with us, we'll try to make sure that he lives peacefully.
Oh
We'll
my
try
god,
to
doctor.
we'll make sure about it.
How will I even tell my daughters about this? I mean,
Yeah, I understand.
should I even call them? What do you think I should do right now?
Yes, I think it's better if you call them because yeah, they need to inform, okay? Because this is they should
Move
know
on to the
about.
next station.
Thank you so much, Dr. Fatima. That was that was good.
I understand
Do
my
you
mistake.
understand? So when you're actually
Yeah,
breaking a
yeah.
bad news, you can't tell them it's bad news in the first place. Because if you
Okay,
start with that, you've already got the patient relative very anxious. So they might not give you the information that you need. They will just want to hear what is the news that you have, right?
hmm.
So you can't get them
Okay,
anxious before getting the information out of them. So you have to be very careful about that.
okay,
You can't say that you have bad news. So you can say that I'm here to discuss. You were very correct in the first go when you said I'm here to discuss about your husband's condition. And then like, yeah, how is he doing? Yes, before we get to that, I'd like to know a few things about his medical history and what has happened. If you can just walk me through what has happened so far, it'll
okay.
be very useful for me. That way I haven't told you that I have something bad yet,
Yeah, I understand.
right? But I'm trying to understand
Yeah,
more
I
about the
think
case.
yeah, that one I thought what like we in that all everywhere we are saying that the patient is any concern, we need to validate it immediately. That's our
That's
duty.
true, but you have to think about how you're supposed to validate it, right?
Yeah.
You know there is
Okay.
a spikes protocol. You know you have to follow all that. You are very aware
Yeah.
of it. But then that's what no. First of all, you have to bring about the setting before you give the bad news. Even telling that it's a bad news is indication for them to get anxious. You can't get them anxious before you get the information out.
Okay.
Because there'll be once you say that there is a bad news, there will be a whole lot of questions that will follow. You need to be prepared to answer all that, right? That's the
Yeah,
main
I
thing.
understand.
Right. So before you have to answer a lot of questions, you need to gather a lot of data. So initially itself, yes, I'm here to talk about your. I'm introduce yourself as the FY2, as well as give them your role. What is your role? Your purpose of meeting with them. I'm here to talk about your husband. Identifiers, good, great, good job on that. And then introduce yourself on, I'm here to talk to you about your husband's condition. And then there will be definitely a response like, yes, I was waiting for you. How is he doing? It's like, yes, I'm here to answer all your queries, all your questions. But before we get into that, if you could give me some information about him, it'll help me with my consultation. That way, I haven't told you this, I haven't told you that, but I've told you my purpose, right?
Yeah, yeah, I
So
understand
then
this
you
one. Yeah.
immediately, they don't know what the condition is, but then they know that they have to answer a few questions, so they will do that, right? And you haven't still given that it's a bad news, because once you start with that, you start with the
Yeah.
word with bad news, things are gonna go bad. Like it is a breaking bad news station, so things are stuck going, she's gonna get anxious, so you can't deal with an anxious patient at
Okay.
all, because then they are also wanting to hear more from you. You can't expect them to answer your questions, right? So that's one thing.
Okay.
And the other important thing that I wanted to bring about is that there is no mention of palliative care.
Oh, okay.
So always remember, if there is not something that is mentioned in the question, do not bring it up on your own. So there is a difference between palliative care and there is a difference between end of life care. So we
Yeah,
have,
but how here is not written anything, but you already asked me the question. How I will answer this question?
what question are you saying that I
Like
asked you?
like what you are going to do then
Yeah, so
about
you've
that
mentioned it's
management part.
terminal. You mentioned it's terminal. So when it's a terminal
Yeah.
case, you give end of life care. Palliative
Oh,
care is
okay.
very different from end of life care. I'll just give, it's a
Yeah.
small difference only. Mainly palliative care is what you give for chronic conditions where you can't do anything.
Mhm.
Right? And they have longer time before you can call it terminal. Terminal is more acute. That it's going to happen within a day or two, right? So that
Yeah.
is end of life, but the treatment is almost the same. They will be making him comfortable and helping
Mhm.
him, giving him ventilation, whatever supports to keep him alive until he is alive, right? But it's almost the same thing, but the duration of what you're giving it for is different, if you understand.
Yeah.
So
Okay.
if there is a
Yeah, I
patient,
understand.
like there's a dementia mother case, so that patient
Yeah.
is a dementia mother who's not eating, so she's deteriorating, but you cannot put an NG tube, you cannot do gastrostomy, you can't do all those aggressive treatments, so you just have to keep her comfortable. She will not die, she will not pass away in a day or two,
Mm.
but it will take a while. In this case, it is going to be very acute, so this will be called an end of life
Okay.
care instead of a palliative care. All right.
Okay.
There is we have
Yeah,
a
I
video
understand.
series on this. I'll send you the video on end of life care and palliative care. It's just a 10-minute video. You can just get a better idea about
Yeah,
what's the
okay.
difference, right? But then nothing is mentioned over here. Just you can just say that
Mm.
we'll keep him comfortable until
Mm.
he's with us, you know. So you're not saying this, you're not saying that. So over here,
Yeah,
it's
okay.
very important to choose your words very, very, carefully. Because those
Okay.
information, if it's not given and if you bring it up, it doesn't reflect very well.
Scripted.
It feels like you have been scripted and you're bringing in another component of another case, because that's what usually we all do. Like everybody who is the examiner, they know what are the cases and they know which case you're bringing in. So be
Yeah,
very
okay.
careful, because there might be a lot of new cases, right? So always read the
Yeah.
question properly. There will be a question card in front of you. Always make sure you read it if you're trying to introduce new terms into the conversation, because then in the other case where it's the palliative care case, you have to explain what palliative care is.
Mm.
That's not even there in your task. You're wasting time in doing
Yeah.
that, right?
Okay.
But the task over here is explain the husband's condition and address her concerns. So the main thing you have to do is explain the condition, and the next thing that there's going to be a whole lot of questions that are going to follow, right? So
Okay.
that you have to be very prepared of. So literally the task, what the in the candidate information, that what it says, what must you do,
Mm.
that is one of the most important points you must read. In fact, even before reading the first few cases, you must read this first part to
Okay.
understand what is the first thing you, what is it that you're required to do. You know, that will give you an idea of if it's an examination station, if it's a breaking bad news station, if it's a this station, that
Yeah.
station. That is what gives you the
That's a
most
good point.
important idea. And do not divert from what is that task, because that's what you're going to get marked on. Sometimes there will be a task where it will be like, ask the patient to come for review, so that is your
Mm.
task, right? Because something similar happened to me in my exam, where one of the ask of the task was to ask the patient to come for review, and I didn't do that. I did everything else. But then my management took a big hit in that station. And I understood why, because I did not do what the task asked me to do. So make sure you
Okay.
always read this what must you do part, because that will be your task, and the rest of it you can, they will only guide you in a way. When you were talking about palliative
Mm.
care, I was trying to bring you back. Like, I was like, what is this, doctor? I don't understand. I mean, just
Mm.
tell me what's happening. I was trying to bring you
Mm.
back. These are small subtle cues that the simulator might give you. Pick up on that.
Okay.
It's very important, trust me.
Okay.
All right, so we have the examiner here with us as well. So he'll also give you his opinion. We'll just put on the checklist.
Yeah, yeah.
So what I noticed is you she said you broke the news very prematurely. You said have you looked at the OSCE workbench? Did you have a chance to go through the in time guide in that?
No, this one. Uh,
So, if you can, I'll just send you a link again. Make sure you go through the OSCE workbench for these cases at least. The ones, anyway, you'll get a
okay.
feedback, right? In that, you'll have a link for each case. So, in this, we have something called an in time guide where it shows you at each 30 seconds what you need to do. So, this will give you a very good structure. Basically, in breaking bad news cases, what you should be doing is you should always start off with a very basic thing. I'm here to explain you about your husband, and then you ask whatever questions you need to ask, data gathering, and then you go into doing your breaking bad news.
Spikes, yeah.
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 So we have a little bit,
Okay.
even in the case overview, we have given a little way of how to bring conduct this case. So I'm sorry, I need to, I can I check a few details before we discuss your husband's condition. You're not saying anything, but then you're asking her to answer the questions, right? Introduce
Yeah.
yourself. Make sure you explain your purpose. May I know how you're related? Yeah, because
Mm.
this one can happen as soon as you introduce yourself, saying that I
Mm.
am Dr. So and so, and I'm from this department. They'll be like, how is my husband, doctor? I've been waiting for you. How is my husband?
Mm.
So if that premature conversation starter comes from the simulator itself, you can have something like, I'm so sorry, can I check a few details before we discuss your husband's condition, if that's all right with you. you know
Yeah. So
very
never say
Okay.
he's not doing well initially.
Okay.
Never do that. So
Okay.
always. So if you're planning to say I'll tell you later, don't give anything out. But if you say that, if you accidentally slip out saying he's not doing well, immediately go into spikes.
yeah.
Just finish it off, because you can always do data gathering after, because there's
Okay.
no
There's no
struct
coming
set.
back from that, because
Hmm.
see, once you say I have bad
Okay.
news, they want to hear what the bad news
Yeah.
is.
Hmm.
So you cannot salvage yourself from that situation. You have to continue saying what the news is,
Hmm.
because they'll be like, you said there was a bad news. No, 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 you said I want to hear the bad news before you
Hmm.
ask me anything more. You've put them on edge,
Hmm.
right? So
Yeah.
there are a couple of ways that you can start your data gathering. So like, what have you been told so far? Has anyone come and spoken to you, just to understand, do they know anything about the results, right? And ask them about, were you present when the incident happened? Can you tell me what happened? That you
Mm.
asked very nicely, actually. You covered everything. actually you actually covered everything from all the conversations. You asked the past medical history, you asked the incident history, but then the only problem was that you got me all anxious before I could say
Yeah,
anything.
I also got anxious. Okay.
You can show the sheet.
Yes, so we'll show your performance sheet.
Uh,
So this is your performance sheet. So
Okay.
yeah. So you got almost all the points, just that you didn't get explore family and social history, because you could have asked a little bit
Yeah.
about, is anybody there. You asked me for invitation. Do you need anybody around you? But you could have asked about the social, like, do you have any
Mm.
support system? Do you
because
have any
she's
other
alone
family?
right now, right? If
Yeah.
you think about it,
So you
we
could have
don't
Mm.
know if.
asked a little bit
Okay.
about, who is there to support you, because I'm going to tell you something really, really terrible. And do you
Mm.
have a support system at this point? That is actually the conversation you're having, because it's a more professional setting. But what you mean is that, do you have anybody that you would
Mm.
like to call? That is, towards invitation. But then before that, can you tell me a little bit about your support system?
Mm.
Like, who all are there around you? Do you have any family or friends around you? So that you understand that how, anybody close by, if she does, if it's too much for her to handle, if there are people who can, take on the
Okay.
controls of what is to happen next, right? So
Yeah.
there are a couple of, so that's one way that you could have asked about the social history. And then we have management. Management, you told about the CT scan, and you didn't bring about the fact that there were neurosurgeons, because if you see in the task itself, the task also
Yeah. This
has, yeah, the mention
various
that,
aneurysm and hemorrhage.
yeah, so it also has the mention of that the neurosurgeons believe that,
Mm.
there is a massive bleed and
Mm.
they are refusing to operate.
Mhm.
It's such a massive
Okay.
bleed that there is no coming back from this. Right? This is
Okay.
after reviewing from the surgeon's team. Because then if you say that I believe or we believe, like, who is the we? You need to understand that this has gone up to
Okay.
the highest level, and after that only we are making this decision. We have tried everything in our power and we can't do anything. It's not like we're giving up on you, there is nothing more to do. You know?
Yeah.
So
Okay.
so those are the ways that you can actually bring about telling them that, this is
Mm.
terminal, or there is nothing more we can do, right? And mm, so more about the invitation. So invitation, yeah, are you ready to discuss his condition? Because once you're, getting them ready, you're asking them about the perception, you're asking them about, how they are, what's their setting, and then you have to SPI invitation, right? Then you have to ask them, are you ready to hear about the thing that I'm trying to tell you, or do you want somebody around you? So that is the purpose of invitation, that you're going to give them a warning before you're going to break the news, right? It
Okay.
can be in the form of, are you ready to hear it, or do you want somebody around you,
Mhm.
right? I'm going to tell you something very important. Are you in the right place to hear it? Should I break it to you right now?
And this is the only point where you would actually tell that he's not doing well, or if you have bad news. Till this
Okay.
point, you make sure you don't reveal it,
Mm-hmm.
because at this point, once you say it, immediately next step is knowledge, which is immediately we have to tell what
See, if you
happened.
see the warning shot, you say, unfortunately, I have some bad news. That's the first time you say that you have the news
Bad
which is
news.
bad.
Hmm.
Right? Until now, you
Mm.
have news. You can't give it a
Okay.
sentiment yet,
Hmm.
just yet. Right? And then knowledge clearly explain everything that has happened so far. So you mentioned that your husband is having a headache, after which he collapsed while watching TV, and he was immediately brought to the hospital via ambulance. We did a CT scan here, and we had the neurosurgeons to review it, and they saw that there was a massive bleed. And I'm extremely sorry. They, after reviewing with these surgeons, they have decided that it would not be feasible to operate on him. So this, they've marked this condition as terminal. After saying that, like, literally you are saying that in a breath, like, literally, this is terminal. Like that's the
Mm.
point where you give the point
Yeah.
that he's going to die. So that's when you should pause and wait for them, because you have to give the worst part of the news and then pause, because you paused after saying that he has a bleed.
Mm.
Right, what does that mean? Like, is he going to come
Okay.
back from that? Like, what do you mean there is a bleed? Like, after that you have to even tell the point that he is terminal, because that's the worst part about the news that you have to give him. It's not that we did the
Okay.
CT scan, it's not that he has a bleed, it's not that it's a massive bleed, it's that you can't do anything about it. That's the worst thing, right? And then pause to see their reaction, because after that only they'll have the reaction, right? Because if you're stopping at he has a bleed, then I'll be like,
Mm.
what does that mean? So then you'd be like, it means he's going to die. So then I'll go crazy. I mean, anybody in that position, what do you mean he's going to die? Can't you do anything else? Right? So then you have to tell them
Okay.
that we've tried everything. Even the highest person in our team has looked into it, and it's
Mm.
something that they can't do anything about. Right? After saying that, only you should give a pause for their reaction, because then they'll have a
Okay.
reaction when they'll start crying, or they'll stop talking, or you have to acknowledge that silence. Even if they stop talking, they'll be like, what? So you need to acknowledge that. It's like, I'm extremely sorry, I know it might be a lot for you to take in at this point, please take your time. And then when you are ready to start, give it like 2-3 seconds of a pause, and then, are you ready to continue? Are you all right to continue? Because your timer is also running out,
Mm.
but you need to be sweet about it. You can't say things
Okay.
like, all right, I have a lot more to tell you, so let's get on with it. So you have to be more
Okay.
like, are you all right to continue? Is it okay if we continue? Something in those
Okay.
lines. All right. So,
Also, I noticed you asked for date of birth. That
Oh
was
yeah,
really
it should be the age.
yeah, yeah. So if you've been given date of birth, then only ask date of birth,
Yeah.
because otherwise you'll have to calculate and all that. So
Yeah.
yeah,
Okay.
yeah. Make sure only in the question whatever is there only you ask. Yeah.
yeah. Because usually date of birth is given for telephonic
Yeah.
conversations, if I'm not mistaken.
Hmm.
But yeah, always use what you have at your disposal, like whatever information you have at your disposal, right?
Okay.
And then eve protocol for these cases. Eve protocol is very vital. Eve is basically, first you understand the emotions, validate and empathize. Right, so there will be an emotion, especially after the pause, there will be an emotion where they'll be like, they want to start crying, and they'll people might actually start crying in these stations. So you have to offer, do you want some water to drink, would you like some tissue, like validate the
Mm.
emotion. First you understand that there is an emotion, validate it. I'm so sorry you're feeling this way, I know this might be terrible news and it's too much for you to take at this point. That's validation. And empathize, saying that I'm so sorry you're feeling this way, right? So all these terrible kind of news, always try to put in the eve protocol, where you're understanding that emotion, you validate it, and then you empathize for it. Yeah. All right.
Okay.
So then finally, the next strategy, spikes, spikes. So S over here would be, what is the next plan, what is the strategy, which you mentioned to be palliative care, but it would be like, at
Mm.
this point, since this is terminal where we can't do much about this, so we'll just try to make him comfortable, right? Yeah, I mean, I know it does sound like palliative, but this would be end of life care. But rather than, yeah,
Okay.
you can actually say that, rather than saying end of life care, you can actually explain what it is, right?
Okay.
And you can call your daughters, because you understood that there are daughters. So what is the next step?
Mm.
Get the family involved,
Mm.
make sure that her
Mm.
social support, because ultimately you are trying to give a holistic care. You've broken your news, but now you're trying to take care of the person that you've broken the news to, right? So the next strategy is for what you would do to the patient, and also how you would be there to support the relatives, right? And since you know that there are daughters, and she said, how do I even talk to them, I don't even know what to tell them, you can offer to talk to them. Be like,
Okay.
I know this might be very hard for you. If you'd like, I can speak with the daughters, I can explain them the condition, I can tell them what has happened, right? So that's like everything from your side you can offer them, right?
Okay.
So that is strategy. And yeah, that is your entire spikes protocol. So yeah, do you have any questions, any doubts?
No, I understand.
Amazing. All right. So ready for the next case?
Yeah. Okay.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.